Welcome to the 25th Annual Winston Health Policy Ball. From the state to the federal level, and from the private sector to the public sector, David Winston worked tirelessly behind the scenes to ensure that the heart of the American healthcare system was beating strong. Before coming to Washington, D.C. in 1977, he served his home state of California as a health policy advisor to the legislature, as Chief Deputy Director of the California Department of Health, and on the faculty of the University of Southern California School of Medicine. As Minority Staff Director of the Senate Subcommittee on Health and for the Senate Labor and Human Resources Committee, he brought an intimate knowledge of every level of healthcare policy.
He was behind what I think one could call a healthcare revolution in the 1980s.
David really helped to usher in. He was in part the architect, but then he was the implementer of a lot of major changes in health policy that are still impacting healthcare today.
He really had a deep love for this country and was extraordinarily knowledgeable about its history.
David was really a student of politics and was so well read and versed.
He would just pull together all of this information, and he was always open to more information.
David prided himself and made sure that everyone knew that he considered himself just a farm boy from California.
He never forgot the salt of the earth, the farmers in the Central Valley with whom he had grown up, to the people in D.C. where there were, the halls of power. He could pull the two together.
I would describe him as highly skilled. He knew more than almost anyone I can think of about healthcare policy.
He loved to preside over groups, so he would convene his staff at least once a week. He'd take us all out to lunch, and we all looked forward to it because we knew we were going to get his undivided attention and we were going to learn some things.
David was a networker before we had Facebook or MySpace or Twitter.
He had many friends and had a tremendous outreach in the public policy area throughout California, and then when he came to Washington.
I would also describe him as bipartisan, which was a surprise to us given the image of the Reagan camp at the time, which most people thought was fairly right-wing. David was open to working with both sides.
He was not someone who was hard-edged ideologically about how to deal with healthcare issues. He was kind of more someone who tried to do, whatever anyone could think up that might work.
And so that knowledge and that value of partnership and trying to create public policy with partnerships, it's really what became the foundation for the Winston Fellowship.
And one of his great skills was if you had a problem, he would know 5 people that could help you out and that who would take his phone call, which in Washington is quite a compliment.
And I've had more people come and say, I owe my job to David Winston.
And he had a good sense of humor. He didn't take himself seriously. He was serious about his work, but he really didn't. He didn't have a big ego. He didn't have a big chip on his shoulder. And yet he was somebody that wielded a great deal of influence.
And talking about how you can share your life and share that joy of just being alive, and then being able to, again, infuse your work life with that kind of joy as well, and that kind of sharing that he did.
This wasn't just any person. This was somebody who was very significant in a personal and professional way to all of us, and he left behind principles and a legacy about the workings of professionals on Capitol Hill and in the healthcare field, about private sector versus public sector and competition versus regulation, and a wisdom about how we all should approach these questions that is very important.
The David A. Winston Health Policy Fellowship extends to future generations the ethics, attitudes, and dedications to America that its namesake brought to healthcare policy. 2 years after his untimely death in September 1986, the fellowship was founded, and for 20 years it has been bringing the country's best and brightest young people to Washington, D.C. to experience the same world of policy where David Winston made such an indelible mark.
David had a special appreciation for younger people entering the healthcare policy field and the contributions that they could offer.
That's the energy that David Winston brought. That's the seriousness that David Winston brought. So to me, bringing these young people here honors the contribution that he made, and that's a really important endeavor for all of us to be involved in.
I feel that the fellowship has been something that's been reflective of David as his career involved so much of his ability to help people to communicate among themselves between groups who never had communicated really before.
The legacy that we're trying to honor here is really expressed, it seems to me, by the fact that we are able to bring in people who I really do think are the best and the brightest.
I think I could say pretty unequivocally that the fellowship has altered the course in the form of my career considerably.
The fellowship has absolutely been integral to my entire career in healthcare policy.
I apply what I learned during the fellowship every day in my work, not only from a technical perspective, but also from the perspective of human interactions and of relationships.
I think it's really vital to bring people to Washington, D.C. so that they can have that exposure. Whether or not they go back and take that experience back to either their states or to their work in the private sector, I still think that having that insider's view into how Washington, D.C. works is really important. It's important not only for our healthcare system, but also for our democracy.
In 1985, David Winston founded the Health Policy Ball. As a social gathering for friends and colleagues in the healthcare field, the ball has become the principal annual fundraising event for the fellowship established in his name. Now, well into its third decade, the Health Policy Ball continues to honor the memory of its founder.
In January of 1985, just before the inauguration of President Reagan for his second term, David and his wife Susan and myself and I guess some others were at a usual wonderful dinner at their home and decided that we really didn't want to go to the inaugural again. And so we should have our own inaugural ball. And that's what started the Health Ball. So it's 25 years later. We've been doing this in the beginning of every year. And it's worked very well. Unfortunately, thanks to all of our sponsors, it's been a great fundraiser for the fellowship.
The future of American healthcare policy is yet to be written. Its shapes and forms will be decided by real people doing real work and struggling on a day-to-day basis with the challenges that this all-important issue presents. The David A. Winston Health Policy Fellowship brings these people to the nation's capital so that young minds can continue to energize the debate with new ideas. By helping these young people walk the halls and visit the offices where David Winston once made his vast contributions, the Winston Fellowship ensures that a future generation will embody the traits that President Reagan saw so clearly in David Winston.
I think David Winston's legacy really is the health policy community as it exists today.
We're excited about what we do. We think we'll be able to continue to grow, and we know we're having an impact on the people that are exposed to this.
In 2009, the tradition will continue as the Winston Fellowship family is joined by Andrew Rozak and Kelly Whitener, two individuals that embody the spirit of public service set forth by David Winston.
I hope to gain really an insider's look into the workings of Congress and health policy in general. Basically seeing behind closed doors what happens and how policy is formulated and drafted and then implemented.
We've both come into this experience with a little bit of knowledge from school, but it doesn't begin to compare to what you can learn on a day-to-day basis of actually working on health policy with policymakers and with all the stakeholders and everybody involved.
This fellowship truly does connect you in ways that are unimaginable and unthinkable. I'm so happy with the contacts I've made and just the amount that I've learned.
It just seems that it's growing, it's taking on a life of its own. And I've gotten the reassurance just by watching everyone else that this is going to be fine. David's legacy is in good hands. And that's just more than anybody could really wish for.